Hello everybody, we're back again today with a new episode of John Rants, and today I want to kind of paint a picture for you of why I am so animated about the threat to the inmates in the Arizona Department of Corrections. And I'm going to just use one example uh, to paint this picture. So that you have a better idea of what the threat really is. And that example I'm going to use is going to be using the Kingman prison. It's actually in Golden Valley, Arizona. The Kingman prison houses 3,500 inmates in total. There's 2 units on the complex. And one unit is Wallapai, which is a medium level sex offender unit. That houses 1,500 inmates. The other unit is a general population minimum level custody unit that houses 2,000 inmates. So the issue with that is that these prisons were built within the last 20 years, and they're indicative of the new correctional paradigm, which is literally warehousing inmates in giant warehouses. So I'm going to use these 2 examples to paint a picture for you. So let me start with Surbat unit. Surbat unit, like I said, houses 2,000 inmates. That is an enormous population of inmates in one location. The unit is separated or bifurcated into 2 sides. One side has 1,000, the other side has 1,000 inmates. But there is cross walking and cross population through the fence for education, for meals, and all kinds of other things. Healthcare, medical unit is on one side. And so what the inmates are housed in is they're housed in these big, giant warehouses. And you can see from the picture that there is a number of warehouses on both sides. And these warehouses actually house a total of 200 men with 100 men on each side. So you will open the door to one of those warehouses and you walk into a room and there's 100 inmates on racks in one side of the room, and then it's open to the other side of the room. There's a dividing wall, but it's open, and there's an officer station there, and then in the back of it there's the bathrooms and washers and dryers and all that stuff. But it's a big, giant, open warehouse with 100 men on each side of the wall. And so these people are living in close quarters. You can see from these pictures show exactly how close quartered everybody is. And so because of the Arizona Department of Corrections contract with GEO, who runs that facility, the Arizona Department of Corrections is contractually obligated to keep those beds filled at a 95% occupancy rate. So that means that they go to all of the other minimum level custody units throughout the state, and if you meet the criteria to be on that unit, they will pull you from the unit you're at, say Tucson or Florence or Douglas or wherever, and they will put you on a bus and they will send you all the way up to Kingman and put you there because they have a contract to keep those beds full at 95% occupancy. So let's dig in a little bit to the threat. Correctional officers, we'll start there. They come from out in the community. And when they report to work, they come in, and the first thing that correctional officers do when they come on shift is they have a group meeting, and a lieutenant or maybe a sergeant, but usually the shift commander will hold a meeting, or a shift supervisor, which is sergeant level, will hold a meeting in a room where all of the correctional officers coming on shift it's a briefing. It's a shift briefing. And so all of them come into a room together, and they're all in a small room sitting at desks like the picture there. and then they're in there for however long a time, and they're going over issues of what's going on in the yard, what things are happening, that type of stuff. So it's a normal briefing, but they're all collected together in a room. So let's just imagine that one of those staff members came in with COVID-19. Now he or she is in close quarters, breathing the air in and out with all the other staff members. And the way that COVID transmits, it's very likely that's going to transmit to other staff members. So now we have staff members, and they're coming into the unit 5 days a week. So maybe the first day on Monday when everybody shows up to shift, maybe COVID doesn't transmit to a bunch of people. Maybe it only gets to 1 or 2 people. But then on Tuesday, when the same people come in for shift and they're all sitting in different seats, now the transmission is different. And remember, the thing about COVID-19 is that you can be contagious with COVID-19 for up to 14 days before you show symptoms. So one of the things that the Department of Corrections has done is they put nurses to test staff and to test inmates coming from work crews to see if they have a temperature. But I don't know what good that does when you can be asymptomatic but yet contagious for 14 days. That means you can be carrying COVID-19 and be transmitting it to other people for 2 weeks before you ever develop a fever. So that's not a good prophylactic measure. That's not a good protective measure. So after these staff members have this briefing, what they do is they go out to their respective units or their respective housing locations. And so 1, 2, or 3 of the staff members, it's generally 2, 1 for each side of in Surbat, 1 for each side of the building. So usually 2, but oftentimes if it's understaffed, it'll only be 1. But then other staff members will be rotating in and out and roving because, you know, staff members have to go to the bathroom and do all of that kind of stuff. So there's a bunch of interactivity. And they come into these big, giant warehouses, and they start interacting in the space with the enclosed inmates that are in that space. So then, I think it's 6 times a day. I haven't checked in a while, but at 4 a.m., at 11 a.m., at 4 p.m., at 8 p.m., at 11 p.m., and I want to say 2 p.m., there are counts. So which means a count means that the staff member grabs a clipboard and then walks over to each and every individual cell and has to do a face to ID count, meaning you have a person's name on a clipboard, you have to reach down, get their ID, match the ID to the person on the bunk, their face, make sure everybody's matching, and then count that person. So the staff member spends between 30 seconds and a minute at each individual bunk in the entire warehouse, and that happens 5 or 6 times a day. Besides the formal counts, those are formal counts. In addition to that, there's informal counts where they come through and do counts. I mean, the Department of Corrections has one thing to do, right, which is their primary purpose is to make sure somebody hasn't escaped. So they do counts. But there's the interaction. There's besides the normal interaction between mail delivery and just being in the same space, there is a one-to-one interaction on each individual inmate in the facility every time there's a count, and there's 5 or 6 counts a day, formal, a couple other informal counts every single day by these staff members. So now you have these staff members who group together, who are in these breathing the same air and interacting with each other and hugging it out and doing all kinds of stuff, not social distancing, going in and dealing with inmates and counting inmates and visiting inmates and having interactions with inmates. So if One of those staff members had COVID-19, and he brought it into the briefing, and then the briefing, a couple of other people get infected with COVID-19. Then they go out and they start interacting with inmates. Now it starts permeating in the inmate complex. Those staff members go home, they come back the next day. Now there's an increase in the number of people that are infected with COVID-19. Now more staff members go out to the inmates, and for 2 weeks, nobody's symptomatic. But what kind of numbers do you think are going to happen? Because when you look at the way that the inmates are housed in these units, they're right next to each other. They're right on top of each other. There's no escape. There is no social distancing in prison. Okay? They're housed together. Okay. And at the same time, these inmates are not given appropriate cleaning supplies to kill COVID-19. They're not given proper hygiene stuff because they have to pay top dollar for it in the store, which I talked about in my last video. The soap that the Arizona Department of Corrections is handing out to people is a little tiny hotel soap that's not even antibacterial. It's fresh scent hotel free soap that you get. That's what they're handing out to prisoners. 1 bar extra a week, or maybe some units 2 bars. It doesn't even kill anything. They're not giving cleaning supplies, they're not giving appropriate hygiene supplies, they're not being given extra supplies for that. Toilet paper, you got 1 roll of single-ply toilet paper every 10 days. Every 10 days. So 1 roll had to last you 10 days. Now, if you had dysentery, if you had a cold, if you had some other reason why you were going through a lot of toilet paper, literally shit out of luck. So in addition to the staff members being in the community, being exposed to COVID-19, bringing it into the facility, and then having direct interactions with inmates, work crews, inmate work crews are still going out throughout the state. A number of them are still continuing to work. So as you can see, this work crew, this female work crew that goes out, that's happening in large numbers. It happens at Surbat Unit, it happens at North Unit, it happens at all your minimum level of custody facilities have outside work crews. And so they go out, they get on buses, they get in little vans, they go out into the community, they're doing work in the community, whether it's colleges, state buildings, manufacturing plants, distribution centers, all kinds of different areas where they use inmate labor. They're in these places. Now they're interacting with public in as much as people that work in these places. And so now there's more exposure. Now let's say this work crew, 1 or 2 members on this work crew happens to come in contact with COVID-19. Now that work crew gets back on the little van and they go back to the unit. While they're in that little van, the air's not circulating, they're spreading the virus to each other. They go back and then they go back into their cramped housing units. As they come back on the unit, some units are checking their temperature. But again, as we go back and say, you can be asymptomatic, not showing symptoms, for up to 14 days. And then these crews go back out. And so the number is exponential. The growth in COVID-19 gets exponential. So now let's just say we have a, because of this situation, because of the actual dynamics of the prison situation, the way that the prisons work, there is a conduit, a constant conduit of COVID-19 coming in from the streets, through staff, through contract workers. I haven't even put a picture up of them that work in the commissary, that work in the kitchen services, that work in medical and all that. There's a constant stream of people coming from out in society where COVID-19 is running rampant, right into the prisons and delivering it to prisoners. It comes in with a higher efficacy than the male. Higher efficacy than the male. So now we have staff members with COVID-19. We have inmates with COVID-19. So now we're on a unit with 2,000 inmates and maybe, I don't know, 150 staff, something like that. I don't know what the total number of staff is. And now staff members start getting sick. Now they start becoming symptomatic. So now, as they're coming into work, it's 2 weeks later after they've worked for 2 weeks spreading the virus around to all the different housing units that they've and staff members and inmates that they've been working, now they begin to show symptoms. Now they become symptomatic, and they show a fever when they come in. So what do they do to that staff member? They can't let that staff member back on the unit, even though that staff member has been contagious for this period of time. So they isolate that staff member. So what do they do when they isolate that staff member? They have to fill the position. They can't, what they call, collapse a post. They can only collapse so many posts. So if these staff members that are grouped together and bundled together and in a collective, if they start getting sick, they can't come onto the facility. So then that brings a new, fresh set of people from society into the prisons. They will start backfilling those positions. They will start doing mandatory overtime. They will collapse certain posts to fill other posts that are higher up on the security hierarchy. And so now, but what happens? Well, now you have a new, fresh set of people that are being exposed to the same COVID virus that the person that just got quarantined is exposed to, because they're going into the housing areas that they brought COVID in, and now COVID is running around inside the housing facility. So now we have a new, fresh set of people that are getting sick. Now we have new staff members, and so now they're going to run around for 2 weeks, exponentially exposing everybody to more virus. And so now we have that, and then they become symptomatic, and they are quarantined from the unit. Then what happens? So you see that cycle, right? That's the hamster on the wheel that's going to happen on that level. Now let's start saying that inmates become symptomatic. Well, when this fire catches in the Department of Corrections, it's because of what you can see there with their housing and the way, the proximity to everybody's housing, the poor maintenance, the poor sanitation, the poor cleaning. What's going to happen is it's going to explode. And so what do you have at SERBAT unit? Well, SERBAT unit has one medical facility, and in that medical facility they have one doctor. They have about, I think, 3 LPNs, maybe 1 RN and 3 LPNs to service 2,000 people. One doctor, 3 or 4 nurses to service 2,000 people. And these people are dealing with angry inmates all day long. So they're already jaded. They're already frustrated with their jobs. They're already underpaid by the companies, the private corporations that they work for. They're overworked. The company doesn't support them. The whole private prison healthcare system is a freaking nightmare from top to bottom. The company doesn't want them to treat people because that comes out of their profit margin, like I talked about in the last video. At the same time, these people have human compassion. They're on the front lines looking at somebody in the eye, another human being in the eye that they know is sick. But also they don't have all that protective equipment, all of that, those prophylactics like the masks and the breathing masks and all that prophylaxis that major epidemiological facilities have that deal with this stuff. So what happens? Well, now the healthcare people get sick, but before that, now it's not just 2 or 3 or 5 inmates a day they're having seen. Now everybody's getting sick, and now the protocols have to be in place. Now we have to start isolating these inmates because we're identifying them as COVID. Well, where are we going to isolate them? We're already at 95% occupancy rate or greater, 95 to 100% occupancy rate in this facility. So now we're going to have to start putting space as specifically moving inmates around from one place to another place to make a quarantine area. Okay? And so that means that we're taking potentially inmates that are healthy, and we're having to move them to where COVID is active to put COVID active inmates that are diseased in isolation. But at the same time, the thing that we've seen in China and Italy is that we've seen the doctors who know how to do sanitation, who have access to the world's best chemicals, the world's best treatment, the world's best hygiene equipment, they're dying. That's the problem. They're dying because they get exposed. And they're 45, 50, 60, 70 years old. So now what happens when there's a massive inmate demand on medical that already can't be sustained because of the low population of the medical personnel. And at the same time, those medical personnel are now exposed and they start becoming symptomatic. They get quarantined off the yard. So while you have staff members getting sick and being quarantined off the yard, contemporaneously you have a massive inmate demand on medical. That creates more sickness at medical. That staff becomes infected, like we've seen in Italy and all over the world, in China and all the other places. Now medical staff becomes infected. And so now you have what? As staff continues, because they were in these briefings and they were working together and they were running together, it's going to break out amongst staff. It's going to break out amongst inmates. It's going to break out amongst the medical personnel. What are we going to do when this society, these little microcosms of society collapse? That's one unit. That's Serbat unit. So now let's just extrapolate it out to, let's say that there's, under those conditions, which are the peak environmental conditions for the spread of a virulent virus like COVID-19, we're in peak atmosphere because of no cleaning supplies, no hygiene supplies, proximity of human interaction, and constant supply of new people coming in potentially infected with the disease, that whole environment. So what happens when that system collapses? Let's be liberal and just say that only 50%, let's say 1,000 people in Serbat unit get sick. Now they have to put a demand on the Kingman hospital system. Now they have to start being transported, because the Department of Corrections has to take care of these people because we have the 8th Amendment to the United States Constitution. They have to receive medical care. They are human beings. And so now we have to start putting these people in the hospital. And, these hospitals, what's Kingman ready for? Four acute cases of COVID on the outside? How many respirators do you think they have in Kingman? Do you think they got enough? Do you think we have a transportation system enough to start getting 100, 200, 300, 400, 500 inmates off that unit into medical? Same thing's happening over at Wallapai. So all of this is happening contemporaneously over at Wallapai. So now we have one unit, we have one complex, and let's say 25% of the entire complex. Let's be really, really tight. Say only 25% and 50% of the staff and 25% of the staff and 25% of the inmates get sick at this unit with 3,500 people. So that's 1,750. That's 800. That's roughly 850 cases or something like that. 35. Yeah, that's 850 plus or minus 75 cases of just inmates alone, plus the staff, that are putting a demand on the system. If only 1 in 4 people get it in those environmental conditions. So the massive demand just on that. Now, here's the really frightening part. Arizona has 14 different complexes, and they're all like this and worse. They're all like this and worse. And they're all in these rural areas. There's a couple in Phoenix. There's one in Tucson. There's one complex in Tucson. There's a complex up here in Phoenix. Perryville's on the edge of town. But the rest of them are in rural areas. They're in Kingman, in Yuma, in Douglas, Safford, Winslow, Florence, where they don't have the facilities that we have in the big metropolitan area. So what's going to happen? What's going to happen when the staff members are all quarantined off the units, while at the same time all the inmates are getting sick because of these environmental conditions? We don't have an answer to that. I called for a week for a special hearing with Director David Shin, who you see right there in this photo. I wanted him to appear in front of the House Judiciary Committee and the Health and Human Services Committee. I also wanted the Director of Human Services, Health Department, to also appear in front of the committees and answer questions, this scenario that I just wrote out to you. This is not a matter of if, it's a matter of when. It's going to decimate our prison population. The reason it's so important is that there is no other concentration of population under these environmental circumstances other than the prisons. Poor parts of town, those type of things, we do have it, but those people have the ability to socially isolate, to socially distance themselves. Those people have access to legitimate cleaning supplies. Those people out here in the world have access to serious hygiene stuff, antibacterial stuff, gloves, masks, whatever. They don't have any of that in prison. Prison is the target for something like COVID, and it is going to explode in there. And it's going to spike that curve that we're all staying home to worry about flattening this curve. Well, what's going to spike the curve is the demand that's going to come out of prisons. So at a certain point, the public officials are going to have to make a decision, and they may have already started making this decision. Who lives and who dies? Who lives and who dies? This is a dystopian nightmare, and it's a reality. It's our reality. This is going to happen. This is how it is. This is the way it is. And I'm going to be out here calling every day to try to get something different. Now, our legislature went into recess until April. So we're not going to get a committee hearing. So now the focus is on Governor Doug Ducey. So what I'm calling now is for every man, woman, and child in the state of Arizona to contact Doug Ducey's office and demand that he and Director David Shin and the Director of Health Services get together and foment an actual plan, a disaster recovery plan, a plan that addresses the thing that I just identified. We need it now more than ever. The number one thing that we can do, if you look, there's an excellent Joe Rogan, I'll try to attach it to this video, there's an excellent Joe Rogan video that he did with an investigative, I'm going to script this word, I always do, epidemiologist, a person who studies infectious disease and who studied infectious disease for 40 years. He's an absolute authority. He did an excellent segment with him, and they were talking about the boats. They were talking about the cruise ships where everybody had the disease on the cruise ships. And what the epidemiologist said is that the government always takes the wrong action by keeping everybody on the boat, because then that exponentially increases the amount of people that are affected on the boat. And those people are going to have to come off at some point. So if they would get people off the boat immediately, this is what the epidemiologist said, who studied this for 40 years, if they would get everybody off the boat immediately, then the disease would be significantly more contained. Instead of 3,000 people getting sick, 300 might get sick. So it's exponentially contained, and they're treated, and they can deal with it. Well, we have 14 prison complexes with 42 units. These are individual cruise ships. These are all, we got 42 cruise ships in the sea of the Arizona desert. And people, they're going to get sick, they're going to die. And the number one thing that we can do, the number one solution, is get the people out of prison. Get them out of prison. So all of the social justice organizations are calling for it. Everybody from AFSC to ACLU to several of the other ones. I could run through them all. There's a litany of them all. They're all calling for this. We're seeing it already happen at Rikers Island. We're seeing it happen in other places, in other jails and prisons. The number one thing we can do is get people out of prison. And so there is a huge swath of people in prison that are nonviolent. They're not people that are going to come out and commit new crimes. They're people that possessed marijuana. They're people that had possessed opiates from getting strung out on an opiate addiction, something like that. They're people that are in there for minor crimes, because Arizona felonizes everything, every act human act you could do, they've got this connotation of being in prison, but really the thing that they did wasn't like they committed some sort of violent armed robbery or murder or something like that. What they did was they had a bag of weed in their pocket, or they had some heroin that they got arrested with, or they stole a car or something along those lines. Maybe they stole some food from whatever. There is a huge swath of people in prison under those conditions. They can come out. They can get released from prison. It won't affect public safety. It's not, but what it will do is it's going to affect public safety positively, because when this thing blows up in prisons, that is an imminent threat to public safety. That, if it blows up in prison, is an imminent threat to public safety. Releasing nonviolent or people with just thousands of people that can come out of prison with no harm to public safety, that's not going to hurt anybody. It's not going to hurt anybody. All right? We lock people up longer than anybody else in the country. If these same people were in jail next door in New Mexico or in Utah or Texas or Colorado or California, they would have been home already. They come home at 50% in those places. Arizona adds an additional 35% on top of it. And that is the threat to public safety. So I'm asking every man, woman, and child out there, if you want to see this, if you believe in humanity at all, if you believe in the human condition at all, and you don't think that somebody that stole a car or had a bag of weed in their pocket or had some heroin on them should get a death sentence, if you think that a death sentence and execution is too much for those crimes, then I compel you to contact the governor. If you believe that on this scenario that I pointed out, which is a very real scenario, that the genuine threat to public safety is leaving people in prison and letting this virus explode in there and then spill out into society, if you believe that, as I do, and as the epidemiologists are saying, then I'm calling on you to ask the governor to release these people. There are mechanisms in law that they can expedite the release. We have Arizona Department of Corrections has identified 6,600 very vulnerable inmates that are going to succumb to the COVID virus. That's 6,600 deaths, and then the correlative expanse of the disease in there. We are about to become the most mass slaughtering state in the country because our politicians are scared of the public pushback for releasing inmates. But you have to understand, the way that we increase public safety right now is by getting those people out of prison. So I call on you to call Doug Ducey's office and demand that he get with all of the organizations and figure out the legal methodology and mechanisms to get those people out of harm's way and decrease the population of prison immediately based on this serious public health threat, and so that we can save lives. Your and my life, and your children's lives, and your parents' lives, and all that. I gladly let somebody steal my VCR to save my children's lives. You know what I mean? Come on, people. Let's put stuff in perspective. Thank you.